Hello and welcome to Experts Unplugged, the speaker spotlights from the Medical Fitness Association Conference, where I, as a fellow speaker at the conference, have been highlighting some of our amazing speakers from the upcoming Medical Fitness Association's 33rd annual conference, which is going to be November 1st to 4th at the Baltimore Convention Center in Maryland. I'm Joanne Newborn. I am the CEO of Newborn Evolution, where we transform your organization's vision into results through leadership coaching, training, and consulting at all levels of the business. So today I am talking to Shanna Dunbar about her talk, Implementing Total Worker Health Model for Employers. And Shanna is a registered nurse certified in occupational health nursing. She's focused on improving employee health throughout her whole career. She's a founder and owner of Workplace Health, Inc., and she works with employers to implement cost-effective strategies that improve employee health and productivity using total worker health principles. So most businesses today, they have been struggling with employee engagement, retention, and recruitment, and I can attest to that. And I'm going to ask you something. Have you ever thought about how programs and services offered in the medical fitness industry can make a significant impact in the employer market? Well, Shanna is going to unpack some of these secrets that she's learned throughout her 30-year career in this presentation. So we get to have a little sneak peek into that. So welcome and thank you for being here, Shanna.
Oh, it's my pleasure, Joanne. Thank you for asking me to participate.
So tell us about the field of occupational health nursing. How is what you do different from a hospital RN?
That's a great question, and I educate people about this all the time. Occupational health nursing is actually in the public health space. So where nurses, RNs in the hospital generally work one-on-one with a patient, in occupational health or public health, we work in entire populations. So our population is from hire to retire, the employer space, where we're advancing the health and well-being of those workers.
Amazing. So total worker health, which is, very specific and it's a registered trademark. It might be a new topic for people in our audience. So can you give a brief overview of exactly what it is and why it's important for employers to understand it?
Oh, I would love to. It's my new favorite term right now. As an occupational health nurse, I've been using these principles my whole career. It basically, total worker health was coined by NIOSH, which is the National Institute of Occupational Safety and Health, kind of the education arm, where OSHA is the compliance side of the house. NIOSH is really more on the education side under the CDC, the Center for Disease Control. And about 20 years, they realized that they wanted to really make sure employers understood the value that they could receive by not only protecting workers through safety programming and things that maybe OSHA is helping them comply with, but also to advance health promotion and advance employee well-being. And I think the reason that this is such an important topic now is that's one of the positive things, if you could say, that came from our COVID pandemic. Employers are really paying attention to this right now. They had to pay attention to health and safety during the pandemic. And there's this lagging effect where we're still dealing with it, particularly in the area of mental health, which I think we all can attest to. And we still have a ways to go to really make sure that we're advancing the mental and physical health of our workforce. And total worker health actually gives us a framework to do that. When I speak with employers, it's not blowing it up and starting all over again, which obviously would be overwhelming. It's taking the elements that you already have and maybe tweaking them a little bit. It's just making slight improvements so that over time you've made a big change and difference. And we've shown that total worker health principles lead to much better outcomes when you're, in all those areas that I talked about: recruiting, employees, the workforce is looking for companies that have a total worker health philosophy. They may not call it that, but that's what they're looking for. They care about protecting your safety, and they care about your mental health. It goes a long way in this workforce today.
Yeah, it's amazing what you're saying, because as you were talking, I'm thinking about the new generation that's coming into the workforce, and they've kind of flipped everything on its head, right? All of a sudden, there was a real lack of talent, and there were things that were very important to them if they were going to accept a role. They cared about things like sustainability and governance and diversity and health and work-life balance. And all of a sudden, they were holding all the cards. So it's great that this spotlight is now being, shown on these things that were formerly swept under the rug. I love it.
Yeah. And, employers still have to get their product or service out the door. So,
Yeah.
A way to approach it, it's not that anything goes, we're not in that kind of place in our society where it's anarchy and anything goes. But that's the neat thing about total worker health. It gives you a framework so that you can actually have some purpose around it, so that you're strategically putting things in place, not just throwing spaghetti on the wall and hoping something sticks, which I see time and time again when it comes to health and safety programs. There's a strategy you can employ. You can get there better, faster, and cheaper with better results. And that's really what I'm hoping to showcase at our presentation.
Great, great. It sounds amazing. I have one more question for you. What opportunities do you see for those working in the medical fitness industry and their employer community specifically?
I'm so glad that you asked that. I was really pleased to be invited to speak to this group. I actually wasn't familiar with it. Somebody had that is a member of the association actually asked me to come and present. And I think there's a lot of great opportunity. Employers are looking for resources. People in my space, consultants that come in to help companies put a strategy together. I can do a great strategy, and I've delivered a lot of different kinds of services, probably similar to what the medical fitness industry also puts into place, but that's not where where I am right now in my career path. I'm going towards the end of my career. And towards the end of my career, that's where we can really be good mentors and strategists for companies. And that's really where I've positioned my company right now. So I'm looking for resources that can come in and fill this space after I do a gap analysis to find out where those gaps are in their programming. Now we're looking at medical fitness industry to say, you can fill this gap, you can fill this gap, you can fill this gap, come alongside us and let me introduce you to some of the employers. And, you want to make sure that they understand their pain points so that they're not going in and inadvertently making changes that might negatively impact their customer, who's the employer. I mean, of course, our employees are the customer too, but
Yeah.
we also have to make sure that we're doing things in a way that's going to really advance whatever strategy that employer has.
Yeah, absolutely. I mean, it has to be a win-win for both the organization and the employees, for sure. I
Yeah.
love that you put that in there. So, is there anything else you'd like to add before we wrap up our nugget together?
I mean, Justin, I'm looking forward to meeting everybody at the conference. If you see me out there, please come over and say hi. I'd love to meet people. I'd love to, have a conversation about whatever's of interest, and what people like myself, occupational health nurses, can do to really help advance what the medical fitness community is wanting to do as well.
Fantastic. So Shauna will be speaking on Friday, November 3rd at 11:30 a.m. So she's going to be right after I speak. So I'm also going to be speaking on Friday, November 3rd at 8:30 a.m. So you're going to need a cup of coffee to come see me. I'm going to be talking about creating rock stars, evolving into a high performance team. So I think these are two great talks that are coupled with each other, because I think they touch upon, creating those strong teams that you need from different perspectives. So I am going to be teaching my proprietary MLD method, which I won't be giving away right now, to build high performance teams. So thank you so much, Shauna. And I really look forward to seeing you and meeting you in person in a couple of days.
Yeah, sounds great. See you then.
Bye bye.